Cardiac cycle review. Atrial contraction. A wave in atria. Phase 2. Ventricle isovolumetric contraction. Pressure goes up in the ventricle from 0 to 80, closing mitral valve. S1 sound is produced while producing some pressure in atria as well as causing C wave. Rapid ejection phase. Pressure in ventricle goes higher from 80 to 120 and aortic valve opens. Blood goes into aorta rapidly. Aortic pressure rises. In atria, there is a V wave because the blood is just filling up the atria. Phase 4. Slow ejection phase. Ventricular and aortic pressure drops, but blood will keep moving towards aorta because of its momentum. Atria is still filling up with the blood and having V wave. Phase 5. Isovolumetric relaxation. Ventricle pressure is falling rapidly. Aortic valve closes producing S2 sound. Aortic pressure is almost the same. Mitral valve and tricuspid valve open. No sound produced. Atria is still having V wave. Phase 6. Rapid passive ventricular filling phase. Ventricle is receiving a lot of accumulating blood from atria. Aortic pressure is almost the same. Phase 7. Slow passive ventricular filling. Blood is coming directly from the lungs into the atria and into the ventricle. Aortic pressure is almost the same. All of these waves were mechanical. EKG is electrical activity. P wave is just before the A wave because of the current atria contracted and made A wave. QRS is spike wave in the phase of ventricle isovolumetric contraction. S and T segment is flat line and lasts during rapid ejection phase and half of slow ejection phase. T wave starts. Detailed review. One cardiac cycle includes one systole and one diastole. Systole equals to contraction while diastole means it's relaxation. On left heart, at atrial contraction, mitral valve will be open and aortic valve will be closed because in aorta the pressure is more than ventricle. Before atrial contraction starts, about 80% of the ventricle filling is passive and already done. Means atrial contraction only fills up 20% of the ventricle and mostly it happens when exercising. When atrium contracts, the pressure in the atrium will go up and A wave will be produced. The blood is transferred to the left ventricle. Before atrium contraction, the ventricle pressure was 0 and it was relaxing. Atrium contracts and all the blood goes to the ventricle and the ventricular pressure starts increasing. Now the atria is going to relax and ventricular contraction will start. The aortic valve is closed because of the pressure in aorta, which is 80 mm mercury. When ventricular pressure grows around 0 to 5 mm mercury, that means now ventricular pressure is more than atrium pressure. Blood will try to go back, but mitral valve will be closed. This closing of mitral valve is producing a sound called S1. This is the first heart sound. In the left side of heart, S1 is because of mitral valve, while the right side of the heart, it's because of tricuspid valve. When ventricle close the mitral valve, a small pressure increases in the atrium causing C wave. The venous blood from the lungs will keep coming and filling up the left atria, and now atrium will work like a tank and keep accumulating the blood from the lungs making V wave. A and C were up-facing waves, while V is down-facing wave. Ventricle will continue to contract. Mitral and aortic valve are closed, so the ventricular pressure will keep rising. The ventricular contraction is called isovolumetric contraction. Blood does not come in or goes out at isovolumetric contraction. When ventricular pressure goes up to 81, the aortic valve opens and blood will be pumped out into the aorta. Aorta will stretch out and receive the blood. When ventricular pressure goes up to 120, it pumps out all the blood in aorta, and aorta's pressure goes up to 120 as well. This phase is called rapid ventricular ejection phase. When ventriculars start relaxing, the pumping of blood goes down. This phase is called slow ventricular ejection phase. During this phase, the mitral valve is still closed, so it is called isovolumetric relaxation. End systolic volume is the blood volume in ventricle left after the ejection taken place. When ventricle pressure goes down below 5 mm mercury, mitral valve opens. As soon as mitral valve opens, the wave in atrium falls down because the blood starts flowing towards the ventricle. This blood was already accumulated by the atrium and will fall in the ventricle without atrial contraction, means rapid passive ventricular filling. After this, blood coming from the lungs will directly added to the ventricle. This is called slow passive ventricle filling phase or diastasis. SA node will fire again and atria will contract. When heart is beating 72 beats per minute, atrial systole is almost 0.1 second, ventricle systole is almost 0.3 second, and ventricle diastole is almost 0.5 seconds. Healthy valves, when opening, do not produce any sound. They only produce sound when they are closing. When ventricle is relaxing and pressure is falling down, aortic and pulmonary valves close, and this makes a sound called S2. So between S1 and S2, it is ventricle systole. Sometime in young people after exercising, heart may produce a sound called S3. If atria is contracting to stiffened ventricles, also called hypertrophied ventricles, it has to apply force and may have a sound called S4. Pressure in the right side of the heart is less than left side of the heart. Aortic pressure is between 80 to 120, while pressure in pulmonary artery varies from 8 to 25. That means left ventricular pressure varies from 0 to 120, while right ventricular pressure varies from 0 to 25.